Today, I'm going to be discussing autoimmune disease and how they can affect pregnancy. So I would say the two most common autoimmune diseases that I tend to see would be Hashimoto's, which is basically your thyroid is attacking itself, and then having a positive anti-nuclear antibody. And that one is a bit vague because it does not say specifically which autoimmune disease you have, but it could be an indicator of having an autoimmune disease, such as lupus or Sjogren's syndrome or rheumatoid arthritis. And then you just have to do a little bit more investigative work. So, and then having a positive ANA means that your body is attacking the nucleus of these cells. So when I look at autoimmune disease, I think about, well, how can we heal the body, right? To prepare yourself for pregnancy so it reduces the chance of miscarriage. Well, there's a few things. One is changing your diet, which a lot of people, that's hard to do. There is a certain diet called the Autoimmune Protocol diet or Autoimmune Paleo diet. So that just eliminates a lot of the top inflammatory foods, such as gluten, corn, dairy, things like that, nuts, sometimes eggs. So it can be somewhat restrictive, but it's not a long-term thing. It's usually for about 3 to 4 months, and then you can slowly add foods back in and see if your body's having any kind of reaction to it. And then you can also heal and seal your gut lining, because a lot of the time when you're having an autoimmune illness, it's because your gut lining is impaired and things are getting through and your body is kind of starting to go haywire and start attacking itself. So things that help heal and seal your gut lining would be L-glutamine, aloe vera, licorice, things like that. Even adding in glutathione, which is probably my favorite thing. It's our body's major antioxidant. So there are studies that show that people with Hashimoto's, for example, have low levels of glutathione. Glutathione helps repair our cells, it helps strengthen them. It's a very good detoxer for heavy metals. It's just a great antioxidant that protects us. So there are a lot of practitioners who might use things such as low-dose naltrexone, and other modalities, but basically it's just ways to help decrease inflammation.